think about healthcare, you might first think about the expensive acute care that we read about in the headlines. But if you ask family physicians, they'll tell you that 90% of your healthcare is in the community. But really, who provides almost all of your healthcare? It's not doctors, it's not nurses or other healthcare providers like me. It's you. Real healthcare is self-care. The best predictor of your future health are the habits you practice today. So the 4 foundations of good self-care are what you eat, what you do, how you feel, and how you relate. What do you put into your body, both healthy and unhealthy things? What do you do with your body? Physical activity that supports all the activities of daily living and helps you do what's meaningful for you. How do you relate to other people? How do you connect at home, work, and school, and with society? And finally, how do you feel? How do you recognize your emotions and how do you manage them? And how do you live a meaningful life? The doctors who compose the divisions of family practice care for our patients in our practices, care for you individually, but now care for our community as a whole. And we're involved in other stakeholders in providing the best healthcare that you can have and to make you the best self-care provider. Let's talk about important cardiovascular symptoms. By this we mean not just the heart, but all the blood vessels, the arteries, the veins. It means the circulation to the brain, to your extremities as well. So a common symptom that we always ask is, have you had any chest pain or pressure? Because the sensations of a heart attack or angina isn't what you typically feel all the time. It may just feel like pressure. It might feel like squeezing. So a typical symptom would be squeezing pressure. And it often can radiate into different parts of the body. It might be just felt in the throat or in either arm. It doesn't have to be right or left. But a typical giveaway that is due to poor circulation to the arteries that supply the heart muscle is that it gets worse with physical activity, anything that makes the heart rate go up. It gets worse with stress. When we ask that, we don't mean that it's in your head, because we know that anxiety raises cortisol levels, raises your adrenaline, makes your heart beat faster, makes your heart work harder, and that could bring out the symptoms of angina or heart type pain. And generally angina is relieved by rest. So after you stop walking, it goes away. Start walking again, it comes back. So if you get exercise or exertion-induced or stress-induced chest pain or symptoms or a throat or arm, do see your doctor. Don't delay. You should see him like soon, like the next day. If you have unremitting discomfort or pain, sometimes associated with nausea or feeling sick to your stomach, it may not be indigestion, that you should go to emergency, particularly if you're older than 50. And I can say that because I'm over 50 without insulting anyone. And if you have risk factors like smoking, high blood pressure, or family history. Do you have palpitations? So if you haven't had palpitations, you probably don't know what that is. So that's a sensation that your heart's skipping a beat, or pounding really hard, or pausing, or beating really fast. So everyone describes it in a different way. Some people describe it just like pressure in their chest. Some people present with chest pain that comes and goes. So sometimes it's really difficult to find out if it's the heart rhythm or not. But it's that sensation that something is different with your heart. So if you're not sure if you're getting that, try to check your pulse when you're at rest, while you're watching TV, or when you're going to sleep. But also check it if you're getting the symptoms at the same time. There's a common arrhythmia or heart conduction abnormality called atrial fibrillation. And it becomes more common as we get older. So that's where the heart's beating very irregularly with the atrium. And you may not notice it if you're not exerting yourself. And we commonly find that just on routine exam. But if you check your pulse and it's not regular like a metronome, it could be fast or slow, but if it's totally irregular, it could be that condition and you should check it out, because that could increase the risk for having strokes. So another cardiovascular system has nothing to do with the chest or shortness of breath. This is pain in your calf, either calf, when you're walking. So we call that claudication. And it doesn't mean that you're awkward or a clodhopper. It's the symptom of decreased circulation to your extremity, to your calf, due to narrowed blood vessels. So it's the calf muscles could be just like the heart. So if you're working them hard, like walking or walking uphill, and you're getting that discomfort, it could be for poor blood flow to the calf muscle. So it's the same risk factors: aging, smoking, cholesterol, high blood pressure. So that should be looked after, because you could have narrowing of the arteries elsewhere too. I think a lot of people have heard of deep vein thrombosis or blood clots in the legs. And often that presents with a leg being swollen or really edematous more than the other side. So there's many other causes for swelling in the leg, but if it's of sudden onset, if it's after an injury, if it's after a long trip, or if you have risk factors for blood clots, do see your doctor, because it's a simple blood test we do, a very sensitive screen as a blood test if we have any suspicion. The physical exam helps a lot too, and we can confirm with an ultrasound. But that's something that needs quick attention if it's a sudden change for you. Do you have shortness of breath on exertion? That means when you're doing more than your usual activity. Walking up the stairs, walking uphill, working out in the gym. So this could be a symptom of heart disease or heart failure. It could be another symptom of asthma or a low blood count or anemia. It could be due to chronic lung disease like emphysema or chronic bronchitis. Or it could be just from being out of shape. So heart failure is different from a heart attack. So heart failure is where the heart's not doing its job as well at pumping. So when the heart doesn't have its pumping action, it creates quite typical symptoms, not chest pain, but shortness of breath. So shortness of breath in what didn't cause you shortness of breath before, like walking up a flight of stairs at an easy pace, or just walking a block can suddenly cause some shortness of breath. If the fluid backs up into the lungs, because the heart's not pumping, when you lie down, you'll get fluid there, and that'll cause you to feel short of breath when you're lying flat, like at bedtime. So that's a typical symptom. Shortness of breath at night, relieved when you're sitting up again. You might have an increase in swelling of your feet or legs, what we call edema, again from fluid retention. And of course that improves when you're lying down, when you're short of breath. And then finally weight gain, like 5 or 10 pound weight gain out of the blue, like overnight. That could be caused by that extra fluid retention. So these are the classical symptoms of heart failure. So if you have any or more than one of these symptoms, you should see your doctor just to make sure you don't have the signs, because it's a very, what we call insidious diagnosis, something that comes on very slowly, so slowly that you may not notice the changes.